During the COVID-19 pandemic, frontline healthcare workers faced an unprecedented psychological burden. Doctors, nurses, paramedics, and hospital staff worked tirelessly under immense stress, often for extended periods. They were exposed to critically ill patients, emergency situations, and tragically frequent deaths. Constant need to make rapid life-or-death decisions, all while worrying about their own health and the safety of their families, created a perfect storm for psychological distress. This environment led to widespread mental health challenges among healthcare professionals, making it crucial to explore new ways to support their well-being. Emotional toll of working on the front lines was immense. Many healthcare workers reported feeling overwhelmed, anxious, and emotionally exhausted. The relentless pace and the gravity of the situations they faced left little time for recovery. Sleep disturbances, difficulty concentrating, and a persistent sense of unease became common. These symptoms are not just temporary stress responses, they can evolve into more serious mental health conditions if left unaddressed. Understanding the depth of this emotional impact is essential for developing effective support strategies. Prolonged exposure to traumatic events can lead to significant mental health effects, including symptoms similar to post-traumatic stress disorder or PTSD. PTSD is a condition that can develop after experiencing or witnessing traumatic events, and it can deeply affect a person's emotional health and daily life. For healthcare workers, the constant exposure to suffering and loss during the pandemic increased the risk of developing PTSD-like symptoms. Addressing these symptoms is vital to help frontline workers recover and continue their essential roles. One of the most distressing symptoms of trauma-related conditions is the experience of intrusive memories, also known as traumatic flashbacks. These are unwanted, vivid recollections of traumatic events that can suddenly invade a person's mind without warning. For healthcare workers, these flashbacks might involve memories of critical incidents, patient loss, or moments of intense stress. Such experiences can be emotionally intense and disruptive, making it difficult for individuals to focus on daily tasks or find peace of mind. Understand why traumatic flashbacks occur. It's important to look at the neuroscience of memory. When we experience trauma, our brains encode these events in a way that makes them more likely to resurface unexpectedly. The amygdala, a region involved in emotional processing, becomes highly active during trauma, while the hippocampus, which helps organize memories, may not function optimally. This imbalance can lead to fragmented, intrusive memories that are difficult to control or suppress. Researchers have long sought ways to help individuals manage intrusive memories and reduce the impact of trauma. Cognitive interventions are strategies designed to alter the way the brain processes and stores traumatic memories. These interventions can include therapy, mindfulness techniques, and more recently, innovative approaches that use technology or games to engage the brain in new ways. The goal is to disrupt the cycle of intrusive memories and promote healthier mental processing. An unsurprising tool that has emerged in recent research is the classic video game Tetris. Scientists discovered that playing Tetris shortly after a traumatic event can help reduce the frequency of intrusive memories. The theory is that the game's visual and spatial demands compete with the brain's ability to consolidate traumatic images, making it harder for those memories to become deeply embedded. This simple, accessible intervention has shown promise in early study. Neuroscience behind Tetris-based interventions is fascinating. When someone plays Tetris, the brain's visual and spatial processing centers are highly engaged. This activity can interfere with the brain's natural process of consolidating traumatic memories, which also relies on visual imagery. By occupying these neural pathways, Tetris may prevent the formation of vivid, intrusive flashbacks. This approach leverages our understanding of how memory works to offer a practical solution. To test the effectiveness of Tetris as a cognitive intervention, researchers designed a clinical study involving frontline healthcare workers who had experienced trauma during the COVID-19 pandemic. Participants were divided into groups, with some receiving the Tetris intervention and others receiving standard care or no intervention. The study aimed to measure the frequency and intensity of intrusive memories over time, comparing outcomes between the groups. Healthcare workers who participated in the study were asked to play Tetris for a set period after experiencing a traumatic event. They reported their experiences and tracked the occurrence of intrusive memories in the following days and weeks. Many found the intervention easy to use and appreciated having a simple tool to help manage their stress. The study also collected feedback on the practicality and acceptability of using a game-based approach in a high-stress environment. Results of the clinical study were promising. Healthcare workers who used the Tetris intervention reported a significant reduction in the frequency and intensity of intrusive memories compared to those who did not. The effect was most pronounced when the game was played soon after the traumatic experience. These findings suggest that a simple, accessible intervention like Tetris could make a meaningful difference in managing trauma-related symptoms. Researchers conducted a thorough statistical analysis to ensure the reliability of their findings. They compared the rates of intrusive memories across different groups and controlled for factors such as age, gender, and previous trauma exposure. The analysis confirmed that the Tetris intervention had a statistically significant effect, supporting the idea that this approach could be a valuable addition to trauma care protocols. One of the key advantages of the Tetris intervention is its practicality. The game is widely available, easy to use, and requires no special equipment or training. Healthcare workers can access it on their smartphones or computers, making it a convenient option even in busy or resource-limited settings. This accessibility increases the likelihood that the intervention can be adopted on a larger scale. Success of the Tetris-based intervention has important global implications. Trauma and stress-related disorders are not limited to healthcare workers or the COVID-19 pandemic. People around the world experience trauma in many forms, from natural disasters to conflict and personal loss. A simple, scalable intervention like Tetris could be adapted to help diverse populations manage the psychological aftermath of traumatic events. While this research focused on healthcare workers, the principles behind the Tetris intervention can be applied more broadly. First responders, military personnel, survivors of accidents, and others exposed to trauma could potentially benefit from similar cognitive strategies. Expanding access to these interventions could help reduce the burden of trauma-related disorders worldwide. As with any scientific research, there are limitations to consider. The study's sample size was relatively small, and participants were self-selected, which may affect the generalizability of the results. Additionally, the long-term effects of the Tetris intervention are still being studied. More research is needed to determine how lasting the benefits are and whether the intervention is effective in different settings and populations. Future research will focus on expanding the study to include larger and more diverse groups of participants. Scientists are also interested in exploring variations of the intervention, such as using other visually engaging games or combining Tetris with traditional therapy. These efforts aim to refine the approach and maximize its effectiveness for different types of trauma and individuals. Some healthcare workers who participated in the study shared their personal stories. They described how playing Tetris after a difficult shift helped them manage overwhelming emotions and regain a sense of control. These testimonials highlight the real-world impact of the intervention and the hope it offers to those struggling with trauma. Integrating Tetris-based interventions into existing mental health care protocols could enhance support for healthcare workers and others exposed to trauma. Hospitals and organizations can provide access to the game and encourage its use as part of a broader strategy for managing stress and trauma. This integration could help normalize the use of innovative, evidence-based tools in mental health care. Educating healthcare workers about the science behind Tetris-based interventions is essential for successful adoption. Training programs can explain how and when to use the intervention, what to expect, and how to track progress. Empowering workers with this knowledge increases their confidence in using the tool and enhances its effectiveness. Tetris intervention is part of a broader digital health revolution. Technology is increasingly being used to support mental health, from apps and games to teletherapy and online support groups. These tools offer new opportunities to reach people in need, especially in times of crisis or when traditional resources are limited. Despite its promise, there are barriers to implementing Tetris-based interventions on a wide scale. Not all healthcare workers have access to smartphones or computers, and some may be unfamiliar with video games. Addressing these barriers through training, support, and resource allocation is necessary to ensure that everyone can benefit from the intervention. Ethical considerations are also important when introducing new interventions. Researchers must ensure that participants understand the purpose of the intervention, provide informed consent, and have access to additional support if needed. Protecting the privacy and well-being of participants is a top priority in all trauma-related research. Cultural sensitivity is crucial when adapting interventions for global use. Different cultures may have unique attitudes toward mental health, technology, and gaming. Tailoring the approach to fit local needs and preferences increases the likelihood of acceptance and success. Findings from Tetris-based intervention research have implications for health policy. Policymakers can consider incorporating digital cognitive tools into mental health guidelines and funding research to further explore their benefits. Supporting innovation in trauma care can help build more resilient healthcare systems. As digital interventions become more common, protecting user privacy is essential. Ensuring that personal data is secure and confidential builds trust and encourages participation. Developers and healthcare organizations must prioritize privacy in all digital health initiatives. Researchers are also exploring how Tetris-based interventions might help children and adolescents who experience trauma. Adapting the approach for younger users involves considering developmental needs and ensuring that the games are age-appropriate. Early intervention could help prevent long-term mental health issues in vulnerable populations. Combining Tetris-based interventions with traditional therapies such as counseling or medication may offer even greater benefits. Integrated care approaches can address the complex needs of trauma survivors and provide comprehensive support. Ongoing research will help determine the best ways to combine these strategies for maximum effectiveness. Support from colleagues, friends, and family is vital for healthcare workers recovering from trauma. Encouraging the use of Tetris-based interventions within supportive networks can enhance their effectiveness. Group discussions, peer support, and shared experiences help create a sense of community and resilience. As technology evolves, new digital tools and games may be developed to further improve trauma interventions. Virtual reality, augmented reality, and other immersive experiences could offer even more engaging and effective ways to support mental health. The future of trauma care is likely to be shaped by ongoing innovation in digital health. Tetris-based interventions are not only practical but also cost-effective. Unlike some traditional therapies, they require minimal resources and can be delivered at scale. This makes them an attractive option for healthcare systems facing budget constraints or serving large populations. User engagement is a key factor in the success of digital interventions. Tetris is engaging and easy to play, which encourages consistent use. Designing interventions that are enjoyable and rewarding increases the likelihood that users will stick with them and experience the full benefits. Using a familiar and non-threatening tool like Tetris can help reduce the stigma associated with seeking mental health support. When interventions are presented as games rather than medical treatments, people may feel more comfortable using them. This approach can help normalize mental health care and encourage more individuals to seek help. Collecting feedback from users is essential for improving digital interventions. Healthcare workers and other participants can provide valuable insights into what works well and what could be enhanced. Continuous improvement ensures that interventions remain relevant, effective, and user-friendly. Understanding the long-term impact of Tetris-based interventions is an ongoing area of research. Scientists are tracking participants over months and years to see how well the benefits persist. This information will help determine the role of digital games in sustained trauma recovery. Raising public awareness about innovative trauma interventions is important for encouraging adoption and support. Sharing research findings, personal stories, and educational materials can help inform the public and reduce misconceptions about mental health care. Collaboration between researchers, clinicians, and technology developers is key to advancing trauma interventions. By working together, these groups can design, test, and refine tools that meet the needs of diverse populations. Partnerships also help ensure that interventions are grounded in science and practical for real-world use. Healthcare organizations play a vital role in supporting the mental health of their staff. By adopting evidence-based interventions like Tetris, organizations can demonstrate their commitment to employee well-being. Providing resources, training, and encouragement helps create a supportive work environment. Adopting new interventions can be challenging. Resistance to change, lack of awareness, and limited resources may slow the process. Addressing these challenges through education, leadership support, and clear communication is essential for successful implementation. Measuring the success of Tetris-based interventions involves tracking outcomes such as reduced intrusive memories, improved emotional well-being, and user satisfaction. Regular evaluation helps ensure that the intervention is meeting its goals and provides data for further refinement. Empowering individuals to take an active role in their mental health is a core principle of modern care. Tools like Tetris give people a sense of agency and control, helping them manage symptoms and build resilience. This empowerment is especially important for those who have experienced trauma. Community support amplifies the benefits of trauma interventions. When healthcare workers and others feel supported by their peers and communities, they are more likely to engage with and benefit from new tools. Building strong support networks is a key part of trauma recovery. As research continues, the future of trauma care looks increasingly digital and personalized. Tetris-based interventions are just one example of how science and technology can come together to address urgent mental health needs. Ongoing innovation and collaboration will shape the next generation of trauma support. Summarize, Tetris-based cognitive interventions offer a promising, practical, and accessible way to help reduce traumatic flashbacks among frontline healthcare workers and others exposed to trauma. The research highlights the importance of innovative, evidence-based approaches in mental health care. By continuing to explore and refine these tools, we can provide better support for those who need it most. Ultimately, the story of Tetris and trauma recovery is one of hope. Even in the face of overwhelming challenges, science and creativity can offer new paths to healing. For healthcare workers and trauma survivors everywhere, these innovations represent a step forward in building resilience and reclaiming well-being.